So over the last 24 hours, we would have had 30 new cases. Currently, we are tracking 239 cases across the country. In Region 1, we have 2 cases. Region 2, we have 8 cases. Regions 3, 22 cases. Regions 4, 144 cases. Regions 5, 9 cases. Region 6, 25 cases. Region 7, 6 cases. Regions 8, 4 cases. Regions 9, 11 cases. And Regions 10, 8 cases. So we have done 2 things. One, we have repurposed the COVID hotline. So if people requires information, they can also call that COVID hotline, and somebody on the other end would be able to give them information relating to monkeypox. We have also added another line, which is toll free, and that is being supplied by GT&T. So the number for that one is 0449. We have a medical person who would be able to guide them and give them appropriate advice. So that depends on the patient's, how the patient has been healing. But generally, from the time of exposure to the time the patient has clinical manifestation. So let's say from the time of clinical manifestation, it will probably be about 14 days or so. Because the disease itself in most instances would be a self-limiting disease. So generally 14 days, 21 days, that patient should feel well and would not be infectious and can be discharged. But again, it depends on the clinical signs and symptoms that the doctors would be tracking. In addition to that, there are patients who can develop complications. So if there are those who develop complications, might have to stay in the hospital for a longer period. So this is something that the doctors who are in charge of the patients would have to make that determination. The persons who the patient has been in contact with, we have been in touch with the names and so that the patient has given us. It is hard to find some of the contacts because he doesn't have any particular on those persons. But the immediate family members and persons who you've been in contact with regularly, those persons are in quarantine. But if you pass by somebody and that's hard to find out who it was that you was next to on this day or that day. So we haven't been able to get all of that information.
So we still don't know where he got
it. It is very difficult to track and trace. Okay. But the immediate family and so they are in quarantine and we are observing them. And so far we haven't seen any signs of anybody developing monkeypox.
Okay.